on the surface of the lung, we'll put a parietal pleura inside the chest. And let me get rid of this hole in the chest. I'll make a new hole in the chest.
No, the neck can go. The rubber bands can go. Sorry.
It's okay.
All right. So if we make a hole through the chest and introduce air in between the parietal pleura and the visceral pleura, are you comfortable with those? Okay. If you make a hole and introduce air between the parietal pleura and the visceral pleura, and air gets into this space, the pleural space, which is a real space? No, it's a potential space. Normally they're stuck together by hydrogen bonds because they're both serous-producing surfaces. They both make fluid. Yeah, well, there's a fluid, and thus they stick together. But if we introduce air into that space, the lung collapses at that spot, and that's a simple pneumothorax.
Okay.
All right? If we make the hole deeper so that we penetrate the visceral pleura and the lung and damage the lung, remember how inhalation works. We raise the ribs and lower the diaphragm, making a vacuum. The parietal pleura sticks to the chest, pulling on the visceral pleura that pulls on the lung. There's a vacuum. It's basically a -4 millimeter of mercury vacuum. But now, since we made a hole in the lung, that vacuum, while it's still pulling air in here, that vacuum is also pulling air out of the lung through the hole into the pleural space. Every time you inhale, more air gets pulled into that space.
So the lung collapses
So the
more?
lung collapses more, and we start to get pressure in that space.
Okay.
That's a tension pneumothorax. And the danger of tension pneumothorax is that when the pressure in that pleural space exceeds the pressure in the inferior vena cava, which you know is only 5 centimeters of water or less, so it's easy to do, then that pressure collapses the inferior vena cava. And now you don't have any cardiac return, no venous return to the heart. If there's no venous return to the heart, there's no blood to go out of the heart. And thus, a tension pneumothorax, by collapsing the superior and inferior vena cava, causes you to have no cardiac output, and now you're dead. You need to step one step that way. Wrong way.
Say if you were to get stabbed, could you cover it up with your hand to try and help yourself? Or
Well, do your best you can, but
Yeah.
if you've torn your lung,
Yeah.
every time you inhale, air is going to be pulled into the pleural space.
Even if you try and block it as much as
Good
possible.
luck, because you're not putting your hand on lung, you're putting your hand on the chest. Now,
So how does, I have a friend that has cystic,
spontaneous pneumothorax?
yeah, I just know she deals with that a lot.
All right.
Yeah.
So she probably has a spontaneous pneumothorax. On the surface of the lung, it's possible to have a bleb, B-L-E-B, that look like a B to anybody?
Sure.
A bleb, which is alveoli on the surface of the lung. And those blebs can pop. If they do,
Okay.
they introduce air into the pleural space. It is a simple pneumothorax, but it happens spontaneously. Nobody shot you, nobody stabbed you. It's a spontaneous pneumothorax. And it's more common in tall, thin, young males, but it can happen to anybody. You've got a female friend who has repeated spontaneous pneumothorax. Now, the weirdest pneumothorax I've ever seen was a catamenial pneumothorax.
What does that even mean?
I didn't talk about that, but since you guys are asking me, and it's the second explanation, I'll tell you about catamenial pneumothorax. The word catamenial is a medical term that has to do with cycles related to menses. That's what the word catamenial means. Now, this woman didn't get a pneumothorax, she got a hemothorax. Blood in her chest every month.
Oh, wow.
And when we finally operated on her, we got tired of putting chest tubes in her every month. When we finally operated on her, she was young, she was like you guys' age. She had endometrium, benign endometrium, not cancer, that had migrated from her uterus to her pleural space. It's called ectopic endometrium. It's rare as hen's teeth. It was benign. And every month when she got her menses, that endometrium bled into her pleural space. And we gave her, we just took it out, and then she goes, well.
That's
Was
crazy.
that was
Really
weird.